Welcome to Health Talk. Today we have with us Dr. Manzone from Los Gatos Community Hospital. He's a board-certified urologist. We're going to talk about prostate cancer, and we're going to start how urology began. Tell us, Dr. Manzone.
Well, at Los Gatos Community Hospital, we have a long tradition of excellence in urology. Urology has been a very fortunate field over the past 30 years. It's benefited from tremendous technological advances. We now have methods where we can treat people with minimal trauma, minimally invasive. And these methods have been developing both for stone disease, kidney diseases, and prostate diseases. Los Gatos Community Hospital is unique in the fact that there are more urologists on the staff at this community hospital than any other hospital in California. And the reason this is about 23 years ago, a technology was developed in Germany to break up kidney stones without surgery using shock waves and placing a patient in a large bathtub filled with water and aiming the shock waves to the stone. This was very, very expensive and specialized technology, and in order to make this available to physicians, we thought that it was necessary to have an open staff model. I went to the American Medical Association, and we discussed and implemented changes in the bylaws of the medical staff at Los Gatos Community Hospital so that we could have physicians who were not in the community come and use this equipment. And this developed into about, as I say, 38 urologists who now do lithotripsy, kidney surgery, prostate surgery, brachytherapy, and many other procedures that have developed and have been facilitated by the fact that there were so many urologists that could make this center cost-effective both for the patient and for the physician.
Now, this has probably brought many urology patients to Los Gatos Community Hospital.
It has indeed.
And that probably has helped you in creating a center of excellence for prostate cancer.
Yes. In fact, over the past 4 years, as new technology has developed, and also with the aid of some local companies here in the Valley, Varian, which is a computer company, we've developed computerized methods of treating prostate cancer. And over the past 4 years, we've treated approximately 6,000 patients, of which only 3 spent the night in the hospital, and none of the patients received any blood transfusion. All the rest were done as outpatients.
Now, prostate cancer affects 240,000 Americans each year, and it is the leading cause of cancer in men over age 50. Now, so tell us tell us more. So who gets this?
Prostate cancer is indeed very, very common. Approximately 1 man in 8 will develop prostate cancer. It's highest in incidence in African Americans, followed by Mediterraneans, followed by Swedish and Northern Europe, and lastly, people from Asia. It has a very strong hereditary basis. If your father, uncle, or brother has had prostate cancer, your chances of developing prostate cancer double.
Now, where is the prostate? You have a model here.
Yes, the prostate sits between the bladder and the end of the penis.
So here it is.
That's
and
correct.
Then, here, you can show it.
So the prostate is this organ here, and the prostate has an important function. Approximately 80% of the liquid that's ejaculated during intercourse is produced by the prostate. And the prostate acts as a nutrient and as catalyst to aid the sperm in swimming and becoming active. Only men have prostate glands, and it gives problems only in men and dogs. In men, it can grow and enlarge and block the urinary tract, and in dog, it can cause constipation.
So this is about the size of a prostate.
That would be a really big prostate.
Oh, okay.
That would be a big prostate. Prostates are generally rated into size in the number of cc's, how large. And this would be a normal size prostate. This would be a pretty normal prostate in a man in his 60s, and all the other sizes that you have here, and the one, including the one you have in your hand, would be in enlarged prostates.
So what happens in men is that this enlarges at approximately age 60 anyway, but something happens at some certain percentage then have cancer. And you were saying that the people who get cancer, it happens in one area of the prostate more commonly, and that sometimes it's hard to see that, so usually you have testing before that period. And tell us about the testing.
Great, certainly. In the past, the only way that we discovered people with prostate cancer, say 15 or 20 years ago, was they would come in with symptoms. They would have difficulty urinating, there would be blood in the urine, there would be pain. And then one would feel the prostate by touching it through the rectum. And that would be the clue that there would be an abnormality, because one would feel something hard and irregular in the surface of the prostate.
And that is called a digital rectal exam.
That is correct. That is correct. Unfortunately, at that time, when we depended only on the digital rectal exam and symptoms, we most often found the cancer when it was too late to cure. There's been a big revolution, big step forward, and that has been a test called the prostate-specific antigen, or PSA. This is not a perfect test. Everybody would like a test that says yes or no, black or white. The PSA is a blood test taken from the arm that follows the activity of the prostate. Prostate-specific antigen is made in prostatic cells. So the PSA is raised when there is rapid growth of prostate cells, as in cancer. It's raised when there is an infection or an inflammation of the prostate. It's raised after the man has intercourse. So if he were to have a blood test done the day after intercourse, it would be higher. It goes up with the digital rectal examination. So in our office, as in many offices, we will first draw the blood for a blood test and then do the digital rectal exam.
Now, you said there was something also fancy with this prostate-specific antigen, that you can get another sub-test.
That's correct. Because the PSA is at times difficult to interpret, we've looked for other things to help us understand who we should worry about. The best thing is to do a serial PSAs. In other words, to start from age 40 on doing a PSA, keeping that record. Because when we see a certain increase in the slope of the curve, those men need to be followed more closely, as they have a much higher chance of developing a prostate cancer. So we don't have a long series in every patient. So this new blood test is called a free PSA. And that means PSA which is missing part of the molecule. And the relationship is that if the prostate-specific antigen is going up because of an enlarging prostate or benign disease, there'll be a very high percentage of PSA in the free form. If we find a low percentage of the PSA in the free form, that is much more likely to be due to cancer.
So now the recommendations, probably the urology societies, is that men start getting a PSA at age 40.
That's correct.
Once a year.
That's correct.
And then when do they get the free PSA?
The free PSA would be whenever there's an increase in the total PSA that raises a question, and as a precursor to making this decision of whether the person needs a biopsy or not.
Now, does insurance cover the PSA and the free PSA?
Insurance covers it, but unfortunately it's not covering it quite sufficiently. Medicare only pays for one PSA a year, and in many patients that's not adequate, because the PSA has another very important advantage. In other kinds of cancers, we don't have, after treatment, we don't have excellent methods